Again, my name is Jordan Dassenbrook, and I'm going to be the presenter for the workshop today. This is probably one of the best days of my life, being up here and being able to share with my colleagues something that I love. If I make it 2 more months, I've been in the counseling business profession for 40 years, and I've seen a lot of changes. I've seen a lot of good changes, maybe some not so, but some good changes. And what we're going to try to focus on somewhat significantly today is the business side of your practice, all right? We're going to assume in here clinical excellence. You all know what you're doing, all right? This isn't a workshop on treatment. This is a workshop on how to market and advertise. This is a workshop on how to use social media, how to get your name out there, how to take your practice to another level, or how to be able to start your private practice. You know, that was always my dream in graduate school, was to have my own private practice. And probably like many of you, I worked at an agency when I got out of graduate school. And I made it all the way to a supervisor. And I thought, yes, right? My supervisor came to my office and said, Norm, you're such a good counselor, we're going to make you a supervisor. And I thought, damn, that's what I've been working all this time for, right? Now I realize I'm making 25 cents more an hour than the other people, and I have 15 overeducated therapists that know everything and don't mind sharing it with me. And I was supervising all the services for the chronically mentally ill in large 2-county area in northern Illinois. And I realized the easiest part of my job is dealing with chronic mentally ill. The difficult job I had was supervising everybody else. Anybody here a supervisor? I feel bad for you. No, I'm just kidding. I decided, I wanted to go work for me. My boss is a kind, benevolent human. I don't have to fill out a vacation request for. I can take time off. But I want to cover a lot of things today, and so I'm glad you're all here. The title of the workshop is Starting, Maintaining, and Expanding a Successful Private Practice, and I like making the difference between what's surviving and what's thriving. I don't know about you, but when I went to graduate school, I didn't think about poverty. I think we should be adequately paid for what we do. And where that starts is right on the side of you, believing in what you do, okay? And I always like to kind of start out the workshop just real briefly and just say, if you were a business person, right? If you were a business person and you were selling a product or a widget that could help a teenager communicate better with their parents, that if you had a product or a widget that could keep a family from disintegrating, if you had a product that could help somebody decide that suicide is not the option, that could diagnose depression or anxiety, okay? That product or that widget would be very valuable in it. You see where I'm headed here? That's you, okay? You transform lives, you save lives. I don't want to be overly dramatic, but we all know that. You all have a skill set second to none in terms of helping people and improving lives. What a wonderful thing that is. But if people don't know where you are, if people can't get to you, right? You have a gift that goes unused. You have a gift that goes untapped. So we're going to learn today that self-promotion is not a dirty word. Okay? And here's the other thing. In order for you to provide the best therapy possible, you have to be well fed, right? If you're worried about if you're going to keep your practice open next week, if you're worried how you're going to make the rent, if you're worried that your kids aren't going to be able to go to college, is that going to affect the therapy that you do? Of course it is. Think about it, right? So today, have some fun, we'll have some laughs, we'll learn a whole bunch of stuff, but I want to see you be successful and not necessarily just survive in private practice, but I want to see you be able to thrive.